Our first paper is Keynote address by well-known doctor from RP Center who has won the award in the community ophthalmology last year. His paper is Nation Survey for Mapping Human Resources and Infrastructure from Eye Care Services in India. Dr. Parveen Vishist, please.
Thank you, sir. In fact, last year I presented this paper in Community of Ophthalmology session and got the first award. This is about the National Survey on Human Resource and Infrastructure for Eye Care Services in India. And this survey was conducted jointly by RP Center, uh, National Program for Control of Blindness, Vision 2020 Right to Sight India. I also represented the Vice President of Vision 2020, and it was funded and sponsored by Orbis India. In fact, when we started Vision 2020 Right to Sight program in India in 2004, at time we had a target of human resource and infrastructure by the year 2020. For human resource, we had a target that we should have 25,000 ophthalmologists and 48,000 paramedical ophthalmic assistant in country by the year 2020. And as far as infrastructure is concerned, we targeted that we should have at least 2000 secondary level hospitals and around 200 tertiary level hospital in country. And this survey was conducted to actually assess whether what we have achieved by the year 2020 in the country. So objective was to obtain an estimate of the number of eye care institutes, services along with the number of ophthalmologists, ophthalmic paramedics in India, and also to link this database to India Vision Atlas, which was developed by RP Center and in which we included National Blindness Survey and National Diabetic Retinopathy Survey. In fact, the methodology was we prepared the list of eye care institute. There was no list available actually. We use all the resources, Google, Ministry, the various NIC district panels, everything was included. And that was a peak COVID time. Our team were available. So telephonically we contacted all the available hospital in the country. You can understand it is a difficult task actually. We targeted only secondary and tertiary level hospital because for primary we are not very sure it actually functioning or not. So the condition was that there should be at least one ophthalmologist working there, whether full time or part time. That was the initial criteria. So 30 staff members, they were given 1 or 2 state each person, and they telephonically contacted all the institutes. In fact, this data was collected online through online questionnaire. We use monkey based software and virtual meeting. Beside contacting all the institutes, we also use Government of India support, where the national level coordinator, we had meeting with all the state program officers one by one, including their district program manager, so that we can get complete data from each district. And in fact, it was again validated. Whenever we get questions, we resend the question to all the institutes so that they can validate this information is right and it is just not written like this. So these are the results. We could get information about 9,440 institutes, I mean to say their email address and mobile numbers. We were able to contact 8,790 institutes. Out of them, 7,901, they actually submitted their data, which is 89.9% total. And we get special information about institutes providing pediatric eye care facilities. So 27.6%, 2,180, they said they are providing pediatric eye care services. Then we use various indicators to judge this data. This Eye Institute population ratio. These are recommended by Vision 2020 as well as NPCB. Ophthalmologist population ratio, optometrist or ophthalmic assistant institute ratio, and this was calculated for the overall country, for each state and every district also. We have nearly 7,039 district in country. For each district we calculated this information. And the best part was that WHO requested us to form eye care situation analysis data, and we use this information for providing this information to WHO, and India was the first country to provide such information to WHO based on this data. We can also develop more indicators as per the need, like pediatric eye institute population ratio, like pediatric ophthalmologist population ratio, and so on. So this is the indicators developed. We have shown India level indicators, and they can be developed for state and district level also. For example, we had one institute per 1,64,000 population in India, total 7,901 institute. As far as ophthalmologists are concerned, I said we had a target of 25,000. We got information about 20,944 ophthalmologists in country, one ophthalmology per 65,000 population country. As far as optometrists are concerned, we got information about 17,856 optometrists, one optometrist in one institute. There are 2.26 optometrists in an average. As far as pediatric institute is concerned, total 2,180 institutes are providing information about they have pediatric ophthalmic services, one per every 6,30,000 population. And pediatric ophthalmology population ratio, it was 8 per 10 million population. This is information ownership. As you can see, the maximum number institutes are in private sector, 70%, in government sector 15.6%, and in NGO sector it is 13.8%. Type of eye services, operation theatre, 87% institute, they have OT facilities. Eye bank is there in 5.7%. Low vision services are provided by 28.3% institute. And various subspecialties, cataract is the leading one, with nearly 91.5% institute they provide cataract surgical facilities. The second component was linking this database with India Vision Atlas, probably very important component, because the report are there in pages, nobody sees that. If we can link with online India Vision Atlas, that can be useful. It is visible to everyone, and anyone can see this information sitting at home also. So we conducted national blindness survey, and India Vision Atlas was prepared with the support of Government of India by RP Center, and we had the data related to entire country data, state level data, survey data, and we added this component of HR infrastructure in this India Vision Atlas. And in fact, you can see all the indicators in this Vision Atlas, and they are available state-wise and district-wise. All these indicators are available. You can categorize these indicators. You can check for state. You can check for district level information also by clicking on the state data. And we can also check eye care institute details in the Vision Atlas. For example, when we click this data on eye care institute, we get information about those institutes. We can further filter them based on the state, based on districts, based on ownership, whether it's government, private or NGO sector, based on facilities available and services available. So all these information can be assessed using this India Vision Atlas. For example, for Kerala, we say it is one of the district LPJ and glaucoma facilities in Kerala. So we can get this kind of information in the Vision Atlas, where you have the name of the institutes available in that districts, and also various services, whether available or not available. So how good it is that even whether it is program planner, policy makers, or even the patients, they can see which institute is available and what services are available nearest to that person. We are able to provide this kind of information to the patient people in our country. And this is also linked with Google Map. So one can also see the distance of that specific institute from them. So this is something very positive. They need to go to that place, they can even go to that place. So it is actually bridging the accessibility issues in our country, where people feel that services are not available. They can actually see whether services are available in their area or they are not available. And it can be updated periodically. We are planning that every 2 years we'll get the similar data from all institutes, so that we can update this information for the country in a regular process. To summarize, where we have adequate number of eye care institute. In fact, target was having to have 2,000 institute, and we have much higher, 7,900 institute providing secondary or tertiary or higher level services. But 70% of institutes are in private sectors, and usually private people, they are not submitting data to national program. It is essential that there should be a public-private partnership. Those institutes should be part of it. The reported number of ophthalmologists are 20,944, quite close to 25,000. Optometrists are much less, 17,856 against target of 48,000. Vision Atlas is helpful for planning also, and also for the people who need to assess about the services. And this was the survey, and I'm really thankful to all the team members, Government of India, they were our partners, AIOS, Dr. Namita Sharma, Dr. Rohit Saxena, Dr. Rajesh Sinha, Vision 2020 Right to Sight, Orbis. So that was a great effort by the entire team. Thank you very much. Thank you.
Thank you, Dr. Vashisht. It was an excellent paper and the prize winning paper for last year's AIOS. And you all must have noticed that it was all inclusive. That was too good, using technology and reaching to the community and taking the data. Excellent, sir, and congratulations.
Do you have offline and online copies of this?
Of this institute.
Data.
Hard copies are there
Of this
in
paper,
your
sir.
institute?
Sir, all online copies are there, hard copy
Online.
or not on.
Not.
So anyone can go to the Vision Atlas, India Vision Atlas, and see this entire.
Okay,
information.
okay, okay. Very well. Thank you.
And it was the best use of the COVID times, I guess.